Well, and I'll keep my eye on that, but since we have such a large panel, I do want to go ahead and get started
Mhm.
to allow enough time for discussion tonight. So welcome everyone to another community town hall meeting on childcare. Thank you all for joining us. I'm Christina Studebaker, Community Impact Coordinator with United Way of Door County, and I'll be helping facilitate this evening's meeting. We've been holding these bi-weekly town hall meetings since October. And so far we've had really good discussions about the joys and challenges of running a child care center, the connection between high quality child care and early childhood education, and then school readiness later on,
Mhm.
and the impact of high quality, affordable childcare on the entire county's economic stability and growth. And so tonight we're excited to hear from a group of parents about
Fun.
their experiences with childcare here in Door County. And I'm going to take a minute to introduce our speakers. And parents, as I say your name, if you could just say hi so that the other people on the screen, sort of Brady Bunch screen, can take a minute to find you and know who you are as we continue talking throughout the evening. So we've got Alexis, Heim, Peter.
Hi.
And Ann Herring,
Hello.
Lauren Daoust,
Hello.
Jessica Hatch. Jessica, you're on mute.
Hello, I thought I unmuted.
And Myles Dannhausen.
Hi.
Thank you. So thank you all so much for your willingness to share your experiences with us tonight. Get somebody coming in. And I also want to thank everyone else out there who's come to hear from the parents and learn more about the realities of childcare in Door County. So as a reminder, we're holding these town hall meetings every other Tuesday from 6 to 7 p.m. And we're getting different perspectives and having opportunities for discussion to share ideas about what the community can do to provide high quality childcare for all families and a living wage for all childcare providers going forward. And the overarching topics that our meetings and our discussions are organized around are access to childcare, affordability, quality, and recruitment and retention of quality workforce. And these are the topics that we're going to discuss this evening. So before we begin, let me just provide a little bit of additional background that I think should be helpful. So I think a lot of people on who are here tonight know that since the beginning of the year, the Department of Children and Families has been working with communities across the state, including our community, to better understand the status of childcare and to discuss ways that things can be improved. And depending upon your personal situation, your personal circumstances, the status of childcare across the state might surprise you and it might not. But I'm just going to give you the highlights of the statewide strategic plan, which is sort of a culmination of a study that's been going on at the state level for the past 9 or 10 months, and tell you what their findings have been on these overarching topics. So on access, they say Wisconsin families struggle to access early care and education, particularly in child care deserts, which are predominantly located in rural areas, and access to care for infants, toddlers during non-standard hours, and for children with special needs is a void that impacts families across the state. And just so you all know, based on the number of providers to kids younger than 5 who might be in need of childcare, that's how they define a childcare desert. And Door County is a childcare desert. On affordability, the report says Wisconsin families struggle to afford early care and education. And this is especially true for single parent families and families of color. families who qualify for childcare financial subsidies often experience additional barriers to accessing them and are unable to take advantage of supports. The cost of providing quality care far exceeds families' ability to pay. And then on quality, they say that quality early care and education exists in Wisconsin. And I believe that we all understand and believe that that is also true in Door County, but families may not be able to access or afford it. And another thing is that families and communities also have varying definitions of quality in order to define what it is to have high quality early child care and education in your community. And then finally on workforce, they say the Wisconsin early care and education workforce is lacking professional respect, adequate pay, benefits, and diversity. Early care and education programs are unable to retain their best workers. And so we're just going to touch on all of these topics with our panel tonight. And I sort of said to them beforehand that we're not really going to have a bunch of specific questions, but we're going to go through those topics and give everyone the opportunity to just talk about their experience, their challenges, positive things, negative things, thoughts on improvement. So we'll do that, and we can give them an opportunity to get rolling. And if other people have comments or questions, you can put them in the chat, and I'll be monitoring the chat, and we'll get to all of the questions at one time or another before the end of the meeting. So why don't we just start with the topic of access to childcare. And parents, if you'll tell us about your experiences finding and securing childcare, and maybe give us a little bit of background. I don't want to ask anyone to share information they're not comfortable with, but if you tell us your kids' age, whether you're doing home-based care or going to a center, or whether you also rely on families, those general outlines of your childcare situation are helpful to help us understand the situations that you're dealing with. So does somebody want to volunteer to start sharing first? And you're on mute, good.
I don't know. I could give you just a little bit of overview. So my son is 2.5. He is currently in an in-home childcare situation, but our path to finding that in-home child situation was harrowing, to say the least. I started off, I put my name, my son's name on the waiting list for the Barker Center when I think I was 2 months pregnant when I put his name on the list. I did not get a call from them until he was, I think, four months old, well after I actually needed the childcare. And through a series of really just inconvenient things, I had secured an in-home position for him. That wasn't working out. But I only found that out, I did finally get the call from the Barker, and then the next day my childcare fell apart. And and this started a series of months where I was desperate and scrambling. At some point, my younger sister came from Indiana and stayed with us for almost 2 weeks to help out because she was a teacher. She had the summer off. She's like, I love snuggling babies. So she came up. We also struggled because at the time, I now work at the schools. I was working at the art gallery, and so I had to have weekend coverage. I had to work weekends. It's just part of the deal. You work retail, you work weekends. So I remember at some point I was literally having the conversation about quitting my job. I was in the process. I was having the conversation. Hey, I'm gonna have to quit because I don't have childcare starting Monday. And I finally got a call saying, hey, I know this woman, she has an opening, and it was wonderful. It was amazing. It saved my butt. But even then, I still had struggled for weekend childcare. And my husband and I ended up doing he took Saturdays off, but we still had to find coverage for Sunday, which we ended up filling with a high school student. But my one day of weekend childcare cost almost as much as my full week childcare, because I was paying for like one-on-one, I was paying babysitter rates, as opposed to, hey, I'm taking my child to somebody who has a lot of other kids. So it was a struggle, and was one of the reasons why I ended up changing careers back to education, because I simply could not handle the stress of trying to find weekend childcare. And I'm very happy that I did. There's a lot of reasons why I ended up going back to education, but one of those factors was definitely trying to find that weekend coverage. And we have spent a long time, we were very fortunate. We have, I call them my Door County grandmas, because I don't have, or didn't until recently, have any extended family living in the area. I didn't have a grandparent and anything like that to rely on, but I had a lot of really wonderful families and other things that stepped in and were like, oh, we'll take Finn for a Saturday. We'll take Finn for a Sunday. And there was definitely times where my husband knew who I was dropping my child off with, but I did not. And I definitely, thank God it's Door County, because I was definitely pulling up to some places going, hi, my name is Anne. Have you met my child? You're going to watch him for the day. Wonderful. Great. So that is kind of my childcare story in brief. Again, we're very fortunate now. I have my weekends off, so I'm not struggling to find that. And I have a really amazing, wonderful in-home childcare situation, but I did not have that until I think he was almost 9 months old by the time everything settled down and I could take a deep breath, barring the Saturdays and Sundays, which I dealt with until this year. So,
that sounds complicated, and
it was
stressful.
it was a lot. It was a lot. Again, my God, my Door County grandmas and my Door County aunts, they saved me a lot. But yeah, it was. I think I did at some point put my name back on the list for the Barker, but I never heard back. Not so. It was. Yes, it was a lot. But
how does that compare to what other people have experienced? Jessica or Lauren, yeah.
I'll share. This is hearing you talk, and it's just like all the things you're saying, I'm going, yep. It impacts your career choices. It impacts everything. And it has been, I have a 7-year-old son and a 3-year-old daughter. And we were fortunate enough when my son was born to be able to get him into Barker Center. We only had to wait a few months before he could get in. And then he was in Barker up until he went into 4K. And fortunately, when my daughter was born 3.5 years ago, she was able to go once I went back to work after my maternity leave. So we really, my husband and I both work full time, but we work Monday through Friday, 8 to 4:30 jobs. We did also need the early morning hours because we both, I taught classes at the Y and my husband would go in early. So, but we were fortunate enough to be able to be in the Barker Center and be able to use that structured daycare. So really, for us, the access issue didn't become an issue until COVID and until Barker closed down. I work at the hospital. And so once that first happened, Barker did try to provide daycare just for healthcare workers, but that ultimately fell through. And so we were without daycare for my daughter all summer, and we kind of just had to piecemeal it together, and it was stressful. I mean, we had to take time off work. We were calling on family and friends that really weren't in positions to be able to help us much either. So it was stressful, and stressful for the kids, not having that regular routine, not really knowing where they were going from day to day, isn't ideal for their development and their wellness either. And then the stress from their parents, they all felt that. I did end up, we had the conversation about me maybe staying home, quitting my job, because what other options were we going to have? And ultimately, thankfully, when the child care center opened again, we were able to get back in, and I was able to continue working. And I also want to say that we've been more fortunate than many others in Door County. I work as a social worker, and I've worked with families who have to rely on other family members for childcare. Oftentimes grandparents who are maybe ill themselves. And with COVID now, it really has created difficult situations and decisions for families to have to make when they don't have affordable, accessible options for other daycare. They have to rely on family members who might be more at risk for developing COVID, maybe high risk if they do get it. And so it puts families in really difficult situations to not have more access than what's available right now.
And Lauren, I just want to make sure that I understood correctly. So even though it sounds like when your son was young, you were able to access it fairly quickly and easily. And then you also had your daughter at the center. But then when COVID hit, the crisis became quick and extreme, so that just because of COVID, you were thinking of possibly quitting your job at that time because of the childcare?
Yep.
Wow, that's
Yeah.
Amazing.
With working at the hospital, that was not ideal. And that was the situation a lot of healthcare workers were in, because they just, there weren't any other options. Without Barker, there was no other option. So,
Alexis, Myles, or Jessica, do you want to add? Myles?
I can go. For my wife and I, it took us a long time to get pregnant, and a lot of expense to get pregnant. So we were so focused on that. By the time that we were pregnant, that's when it kind of first hit me of, oh, now we got to figure out this other huge challenge. And luckily I had some friends who had just gone through it, and they were right away, they're like, call the children's center now, get on the list and keep calling. So I live in Sister Bay. So the Northern Door Children's Center is the option for a lot of parents here. And so I did call and put on the list, but it takes so long to know what your status is going to be that in our case, we are somewhat fortunate in that my wife and I both have day jobs. I mean, I cover a lot of evening meetings. She generally would have a lot of travel for work, but like the day to day is like a 9 to 5. And I have so many friends who have the juggling of different restaurant shifts and retail shifts that makes it, I can't even fathom how you make that work. But in a weird way, COVID sort of made it easier for us, because my wife would normally travel a ton. So it would make things a lot more difficult, but right now she can't travel at all. So it has made these first few months, we had our first child in May. It made it a little easier in the sense that like you didn't have to plan around work travel and things like that. On the flip side, you also you can't have friends and family really help you, because you're trying to be as isolated as possible. So there's like a pro and con on that side. But my friend just kept telling me, like, just keep calling, make sure, don't take it for granted that you're on the list. And I don't know if that helps or not. I don't know if it matters or not, but I do know that by continuing to badger, we did end up getting in at about the 3.5 month point. But at the same time, we were simultaneously doing the interviewing nannies and babysitters to see what we might be able to cobble together, because my parents are up here, but they're not really an option. They're almost 80. And then with COVID, definitely not an option. But then you start looking at the price, and if you're trying to get a babysitter in Northern Door, I don't know what it's like elsewhere, but $14-15 an hour was like the low end for any option. So you start doing the math, and it gets kind of scary. So we got very lucky at the last, like probably a week before my wife was going to have to go full time back to work. We were able to get into the Northern Door Children's Center, and that's been great. I mean, I feel incredibly lucky. We live like a mile down the road, but that fear for a little bit of going, how are we gonna, like the anxiety everyone has, and the anxiety of having that and having it fixed is nothing compared to the people who actually are dealing with that day in day out and can't get in. And I think we might have benefited by being on the list right during COVID, because I do think some people, a lot of prospective parents at the children's center got off the list, and we kind of leapfrogged them. I'm thinking just because, or they never even got on the list because they weren't going to send their kids outside the home. So that might have helped us get our foot in the door.
I think you might be right. From what I've heard, Jessica.
My story is a little different than everyone else's. We live in Bailey's Harbor, and I have 6.5, almost 7-year-old daughter, and I was working full time in Sturgeon Bay at the time, and about 2 months before I had my daughter, we had to sit down and how are we going to do this? How are we going to juggle this? Looking at what the access options were for us, and then the bottom line on the financials. And we had made the decision that, by the time we mapped it out, if I would have stayed working and commuting and paying, let's say my daughter could have gotten into Barker, and paying what the rates were at that point, after a 2-week pay period, I would have brought home less than $100. So almost my entire salary would have gone to childcare. And my husband and I weren't comfortable with that. So I quit my job. And when my daughter was about 9 months old, my husband could tell I was getting a little nutty. And we kind of chatted, and I made the decision to just, I reached out to Northern Door Children's Center and did a walk through there. And I put her in just 2 half days to give myself the time to grocery shop and, okay, I clean the house in a half day or just whatever I could get done. And after she was there, the first about 6 months, they had a staff member leave there, and they were looking for an administrative assistant, and it was part-time. So I actually ended up working there part-time and raised my daughter's hours to match what my schedule was, which was really nice. And after I was there for about almost 2 years. I had wanted to transition back into full-time work, but the position was part-time. So I finally made that transition back into full-time work, feeling comfortable with where she was, and that my salary at that time would be able to cover it. That being said, the round trip to drop my daughter off from our house because I work in Bailey's Harbor, was 40 some miles to drop her off, go to Sister Bay and come back. So at any given day, our round trip access is almost 100 miles of commuting, which was, we just did it because we had to do it, and it was great. It was just the most wonderful place for her to be. And she still is at Camp Cool in the summers, and even this summer she did 2 half days. We're fortunate that my husband is self-employed and we have a little flexibility, and when COVID hit, he has borne the brunt of school a majority of that time, since he's self-employed, and kind of has juggled his hours around school and everything else. But I would like to add also that where I work for Door County Broadband, and we had a single mother that was an employee that lived on the south side of Sturgeon Bay by the McDonald's, and she had a child in Sebastopol and a child in Barker, and then something happened where she lost access in Barker. So she would commute drop her daughter at Sevastopol, drive to Northern Door to drop her younger daughter off, and then come back to Bailey's Harbor. And then at the end of the day, she would have to go to Sister Bay to pick up her daughter in Sister Bay, and then drive all the way back to where she was dropped off the bus in Egg Harbor, and then back to Sturgeon Bay. So she had a 3-hour commute on a daily basis for childcare as a single mom.
Along with the additional transportation costs into the childcare costs, right?
Additional everything. I mean, that cuts into quality time as a family, that cuts into like your meal time, your prep time, you know, and everything. And that's hard on kids, you know, getting the little one up, you know, 2 hours before they really need to be up to get in the car to get going on the road to make that long haul. And then the same thing at the end of the night. I just can't even imagine it.
So Alexis, I think you're the last one we haven't heard from yet about.
Yeah, thank you. So I wanted, my background, my family's Door County story started in about June of 2017 when my husband got a new job up here. And so we relocated from Green Bay. Matt and I were engaged at the time and about 3 months pregnant, 2 years out of grad school, and our whole lives were in Green Bay. So to move up here on its own with its own challenges of house hunting, me trying to decide if I wanted to stay working in Green Bay or trying to find a new job, that whole thing. There's a lot of challenges, and childcare sort of just built on itself for all of those things because we didn't have any sort of network for an in-home to explore those options. So we knew that one of the centers was going to be sort of where it was at for us. We put our name on the list at the Barker Center at the time almost right away. So similar to Anne, we were still like 3 months in though, 4 months. It was probably 4 months pregnant by the time we figured out like what we were doing and where we were. We ended up we live in Sturgeon Bay now, and we're told basically, Barker Center wasn't going to be an option when we needed it. So for the first 3 months, Matt was actually driving from Sturgeon Bay to Sister Bay to drop Jackson off at daycare and then back to Bailey's Harbor for work at the Ridges. So that was pretty stressful. And like relating to everything people have said, it's kind of the benefit of going last, I guess, is like I hear everything. And so then it kind of came down to I was commuting, so I know we're talking about access now, but I kind of will wrap everything together, I guess, because it came down to the center's pricing and me commuting back and forth to Green Bay, Matt commuting from Sturgeon Bay to Sister Bay to Bailey's to Sister Bay to Sturgeon Bay. I mean, it's very tight for a very long time. But Jackson now has been in Barker and now the Door community. He's going to be 3 in January, and it's a good situation for us now, but as a new young family coming to Door County, I definitely have the perspective and sensitivity to all of that stuff. So,
well, and I'm wondering, thank you all for sharing that, because all of your stories, there's some similar themes, but there are also some differences in what you've been through. I think a common thread that I hear from a lot of people, but I know I'm not hearing from everyone, particularly there's a lot of people who use home-based care that haven't been able to connect with and learn more about what's going on there. But people are able to somehow or another, it's like some sort of magic wand waves, or it probably doesn't feel like to you like a magic wand, but somehow like the pieces come together, but yet it seems very stressful. And so on the one hand, it's like, is this just one of the many things as a parent you say, yeah, being a parent is difficult and it's a struggle, but you sacrifice? Or have you, talking amongst your family and friends, said there's got to be a better way to do this? And is this just the way it is, or is there a better way? Myles?
If I can go out, I was thinking and listening to everybody is that as an employer at the Pulse and having had like several moms and dads in the last few years trying to figure this quandary out. We have one of those families now driving from Sevastopol to Sister Bay, back to Bailey's Harbor, or now when they work from home, sometimes to Sister Bay to Sevastopol and then doing it again. And you can see the toll, like physically, you can see the toll on your employees when they're going through that. And you just know that it's affecting them at work. It's affecting like how they see their job because they're worn out and they're coming, like they've already kind of done a job before they get to their desk. And as an employer, sometimes you can go like, it hurts your ability to get the most out of that person because it comes out on you to some degree, not like in an overt way, but it just comes out at the workplace a little bit and in their stress levels. And you just see it, that has to also be taking that same toll at home for them and in their ability to have like well-rounded lives. If you're spending 3 or 4 hours a day just trying to figure that commute out, it's really difficult. And for families, like Alexis said, when she moves here, like we came back here from Chicago, where I think there might have been like 9 daycares on like a 3-block radius of our apartment. And then you come here and you go, well, your options are like, well, there's this one little thing in Ephraim. There's this one down in Sturgeon Bay, and you might be able to get into this one way up in Sister Bay, and they're all 40 miles apart. Like that's gotta be such a, like just slap in the face for a family that already went through the housing hurdle, maybe the internet hurdle. And now it's like, oh, we don't have an option to take care of our kids hurdle.
Job hurdle too. For me, that was a big thing was when at the time when I carry the insurance, I technically on taxes am the breadwinner, and all of that. So there was not really an option for me. And I've hunted for jobs even a couple times now with COVID, before we were working from home. And the job market up here for my particular interest and skill set, it's just more well suited for Green Bay. So there wasn't really an option even for me to relocate jobs, and having the access to childcare of just like the one center. And then maybe there was like a church basement in Jacksonport that was like, I don't know, like Myles said.
Yeah.
So yeah, it's interesting.
I think the other thing with like, especially with employers, like I was very fortunate because there was definitely a few Sundays where like we found childcare at like 9 o'clock on Saturday night. So we had our employers constantly on, well, if this falls through, then I have to call in sick. So it had to like, beyond like the stress for me, like, thankfully I had very, very kind coworkers, and so did my husband, that because there was definitely times where it was just like Saturday night going, this fell through, this fell through, this fell through. I guess maybe I could switch shifts with this person and we could cover early, but then I'm going to my husband works at a coffee shop, and there was definitely a few times where we were like handing the child off at the coffee shop as I was going somewhere else. And I think at one time there was like half an hour we had to have like a friend of ours sat with our child at the coffee shop, so there's like, there's, there has to be some kind of incentive for employers, because we are not showing up our best when you're that stressed trying to find some place to put your child for a little bit.
I
So
would
that's why I was
definitely
really
agree
happy
with
when
that.
I saw Myles' name on the list as an employer too, like, and a dad. Like, are there conversations in the county happening? And I don't mean to put you on the spot, that's not the point, but I'm just like, to Christina's point, I'm really curious.
Conversations about
like, yeah, just like employers and being incentivized to join this discussion. We've had these United Way's had these calls and stuff like that, and it's just really interesting. It's the same kind of people that show up every week, and as a county board supervisor, it's been hard to sort of engage the employers on this, I think, too. So I'm just curious.
Yeah, the only thing I've really heard is a little bit of and I like Brian Stevens was very active when things were going on with the Barker, and that's a credit to him. But I think in general, maybe people raise their kids and they kind of go like, okay, I got through it, and move on. And as an employer, I know it's something I've thought about a lot the last couple of years. And you have like these challenges here, right? There's a housing market, and if you try to bring someone in, like how do you help them find a way to stay? Because every time if someone's renting, you're just afraid they've got one foot. It's easy to leave if they're renting, right? And then if they get a house, there's the internet question. I've had employees come in, hey, I'm looking at this place. I'm like, no, you aren't. Like that's not and it's not so much like just for my job. I'm like, you're going to be miserable. Like anybody under 50 who can't, basically anybody at all at this point, but especially younger people, if they can't stream all of their entertainment needs, like they're not going to be a happy person in whatever house. And like all those things as an employer sort of come back on you. And years ago with Husby's, we offered health insurance back when it was so much cheaper that like a bar could just insure most of our employees. Could never do that now in that case. But even that, when you put that burden on the business owner, well, as the health insurance keeps going up, the employees don't know that you're necessarily paying more for them. So they're not seeing it as a raise. They're just seeing you cut back on what the quality of that healthcare is. And you're going, I'm just trying to control the cost to like make it work. Yeah. And so all those different things are kind of these things that put like a wedge between you and the employee that have nothing to do with their job. And same thing with daycare, the lack of daycare. My brother lives in Brussels, Belgium, and he hears us talk about this and he's just like, oh, that's so weird because yeah, we have like the public daycare option and then we can just pay more for the really nicer daycare option. I'm like, I hate you. Shut up. We're ending this FaceTime now. Like, yeah. But back to the root of your question, like, no, I haven't. I think it's like a lot of things. It becomes like the business community isn't as involved in this discussion. Same thing with the affordable housing. It's starting to change a little bit on the affordable housing question, but like it's a lot of the business owners are just like so exhausted and so like stuck in trying to do their day to day that they're not showing up to advocate for the housing. So when you have like a housing proposal, what you end up having is the NIMBY situation dominates the conversation instead of if you have that same conversation, but like Bob from the Bayside and James from Husby's are in there saying, hey, we need housing for our employees, that changes it. Same thing with childcare. If people came in and we're in those meetings all the time saying, no, you need to do this or we can't keep our staff, that changes it. And that's a very long-winded answer.
Well, it's a huge question. It's not, all of these things are not easy to answer, even individually. And when you hit on exactly what you did, Myles, with anyone, especially the younger people, which we see as the future of the county, right? The employees and the schools and the tax base and all of it, that the housing, the internet, the childcare, it's all wrapped up together. And so also just concentrating on one, which is a huge challenge in and of itself, doesn't solve the problem because, yeah, we've got childcare, but guess what? You've got nowhere to live. I mean, it's just like crazy, right? So
but you're homeless.
A lot of community coordination. They're very tough questions, but I think that's this community, we are fortunate in that we do have a lot of communication and efforts at coordination. And I think there's a lot of energy directed at that stuff. Jessica, did you, or Lauren, did either of you have something to add to what people have said so far?
Well, I think we all know we have an aging community in this area, and all of the points that, Myles and I are on on the same point with the housing and viable internet and childcare. Those are the three factors that are going to allow people coming into this area, which we do have a huge influx of people purchasing homes in the area, and coming from areas at this point during COVID, because obviously it's, a more affordable area for them to live than, say, the West Coast or the East Coast. I think that they're not necessarily doing their due diligence to, tick all those boxes when they just kind of assume, okay, I can find somewhere to live. People are getting in bidding wars over houses at this point, from what I've heard, from real estate agents in the area. And then in turn, not realizing that we don't have internet here. And then we're moving our kids here because, hey, we can just do remote learning, but we have no internet for that remote learning to follow through with that. Or maybe you have multiple children, and some of them would be remote learning, but then the smalls would have to go to childcare. And what do you mean there's a 60-mile trek to get to childcare, or there's a wait list as long as your arm? Because we do have a massive influx of babies currently in the county, which we have for a year and a half, I think, at this point. We have a higher birth rate than we have had in a very long time in the county. There is a massive wait list at the Children's Center that has been for about a year and a half at this point, because there's ratios in place for, safety. And there's just got to be something that brings commerce to the table to try to attack some of these issues to help us as a community. And I know we can't put all of the pressure on just the employers to fix it. We need, a lot of people at the table that are going to be creative with ideas. Steve Jenkins had a lot of, great points in his video that I watched, and I talk to him at work on a regular basis. But we're really good with creativity in this community, if anything. We have a lot of creative brains and a lot of people that, we want to be here, but we have to find a way to make it work. We thought we were over that hump, and then, COVID hit, and then we've had to sacrifice, more than half of an income this year so that we could have our daughter at home learning, and, a majority of the summer as well. So, having it be further, closer, not further than, maybe every 15 miles we could work on having a childcare facility, or 20 miles or something. I know it's a lot of hoops, but I think, there's a lot of federal funding that's going to have to kind of come in to our community to kind of help with a lot of the issues that are big, because they're big issues. They're not
Well,
little issues.
With the childcare question, I fear that it will get lumped in, and already has, be talked about in terms of like a social service type of question, when in most ways if you're talking childcare, you're generally talking an economic development question.
Yep.
And Steve has talked about this too, but there is a really good friend of mine who moved back here a couple of years ago. His wife wanted to return to the workforce, but as long as there wasn't a place to take their child, this is before COVID, with no childcare available, she couldn't return to the workforce for about an extra 6 to 8 months. That's a lot of income that family lost. It's a lot of stability. It slowed down their ability to purchase a home. Eventually they got in, and within a couple months, they finally moved forward on their home purchase. And those are the people we need to get our claws in Door County to keep them here and make them part of this community, so we can slow that aging curve.
Yeah, absolutely.
Lauren,
Can I
were
ask
you going
another
to say something
question?
earlier?
Yeah, I was just going to add that, your original question, Christina, I think we did a really great job. And like Jessica had said, we do such a good job in this community of being creative. And, there were so many magic wands that that pulled things together. I'm just thinking about since COVID hit, employer, I mean, I at the hospital, and I know churches, reached out and said, who do you have in your house that, do you have a teenager that can babysit for so and so? And I think a lot of people did pull together to be creative to make things work. And I don't think you see that in a lot of other communities. But that being said, I think we can do better. And I think, speaking for our personal experience and my family, just the stress and the uncertainty of not knowing and not having, not that you need an option all the time 100%, but just not having any options to pick from, really. It I think we can do better. And I think, our community has so many, somebody had mentioned, when you work in retail, you need childcare on weekends, you need night. At the hospital, most nurses work 3 12-hour shifts. They don't need to sign up for a full-time slot at the daycare center and pay for 2 days that they're not going to use, but they do, because otherwise they don't have any option at all. It's just, there needs to be more flexibility and more options. Not that there's going to be one size fits all, but I do think we can do better, just in terms of finding alternative ways, alternative options to offer for families.
Christina, if I may, I'm listening to what all of the parents are saying. The expense and the accessibility and the commutes are your lived experience of it. The availability and the expense and the geography is also part of the provider's issue as well. When they can't make a living wage, it's hard to open a business. It's hard to get the risk insurance. It's hard to get staff. So there's this vicious circle of what parents need and what providers have to have in order to just be in that profession and be someplace that's 10 miles or 5 miles from your home versus an hour and a half to schlep to Northern Door to find something for your kids. So how I've come to think about it is, I just read what's being discussed in the community, and how do we increase a room tax, or how do we, the taxes we pay for schools. It's early learning in childcare. I mean, there are things you need for your child just for their basic safety. There's things you need for your children to help them learn and thrive and ultimately become competent and confident citizens. So if we wait for Washington, or even the state, we may wait a very long time. How is it that we might create a compelling case for some sustainable, renewable funding source? Because this is a basic service that people in a particular age group in our county need, just like there are basic services that the aging out population needs, because that's where they're at. So I don't know. I struggle with what might be possible, because you can't have one. You can't have easier access and more affordability and geography without also having the other end of making it a viable business proposition for people to offer that as one of the businesses. Just like Husby's has a business, we need more than 2 childcare centers in Door County to support what's needed as well.
Absolutely. It's hard. I'm here with 2 hats on tonight, and I have 2 wonderful people logged in that are also, Jane is our librarian at the Children's Center, and Jen Thompson is our president. So, when I sat down and looked this over, I'm trying to answer from a parent perspective, because it is. And then, when we get into and move to affordability and quality and workforce, that directly impacts the hat I wear as a board member, and the way that I think about that. And, we have had a wonderful history established in Sister Bay that the reason that it's there is because a group of parents came together and kind of started their own, and then it kind of grew from there, and they finally found a permanent building which no longer exists, where the condos are going up in Sister Bay. And then, you know, they were there for many years, and finally, you know, they fundraised enough to like go into the building we're in currently. And, you know, that has been a long rocky path financially for, you know, us as a not-for-profit, and it's not easy to do and survive it. And, you know, all of the things that we are going to move into with affordability, quality, and workforce, those are really tough pieces in that puzzle.
Mhm.
And unfortunately, we kind of the way our funding mechanisms and our support mechanisms work is we pit some of the people trying to accomplish the same thing against each other with, like, we incentivize schools doing 4-year-old kindergarten at the same time that guts childcare centers
Right.
in rural areas. And
Oh. Yeah, I mean, we would not survive without our 4K program. There would be no childcare in Northern Door without it. That is a very tough piece.
Yeah, and I think that shift, we're still seeing the impact of that shift and that introduction of 4K, and people needing to come up with a new model without the state or federal funding right around the corner. You know, if that comes, you're right, Margie, it'll be a long way out, but those are the models that in Europe, right, where Myles
Right.
pointed out, when everyone's like, what do you mean? What do you just want to take everyone over there and go, look, this is like a different planet. the amount of stress and the quality of what's going on and what it does to everyone's quality of life and the economics of things. But Steve Jenkins has talked about it this way, and I agree that I think we're also in this shift where when you start to think about all these things, the broadband, the child care, and the housing as the infrastructure that has to be supported. You can't ignore infrastructure or things crumble, right? And we're a community of choice in a lot of ways. But a lot of those things that are a community of choice are sort of on the outer perimeter. But it's the flashy, shiny objects that get people's attention. And we have to pay attention to the infrastructure that also supports this being a community of choice. And that's what these conversations that are going on, and it's slow movement because it is a big shift, and it's a lot to bring to support these things. I think we're moving in the right direction, but we are definitely open to ideas that people have about what can we do to improve things, what are things different. We're reaching out to the business community, staying in touch with them. Those conversations take time. We're looking for grant funding. We're looking for ways to not only support our current workforce, but when people talk about the attraction of opening a third group center here, even if we could build the bricks and mortar thing, that's actually the easy thing. We probably have the kids, but we don't have the workforce. We don't have an additional 25 people to staff a center and also pay them a livable wage. So that's a big hurdle. And so just being mindful of all the different pieces, and we have to keep having the conversations because eventually we're going to find a path or two. And I think what Lauren said is also very important, that a lot of times the centers get a lot of attention, but for the sustainability of childcare in the county, we need different options because different families have different needs. And so we need to build a system that supports our economy, which is a lot of evening hours and seasonal work and weekend hours. And so I just wanted to put out there that as you talk to others, let them know United Way, particularly me, can be the collection point for ideas and ongoing conversations, because we are actively working on these things, and ideas that people have, we would love to hear them, because we're going to make forward movement at some point, hopefully before all of your children graduate high school or college. And I'm happy to continue the conversation, but I'm also mindful that we are nearing the end of the hour. We've had a lot of discussion from the panel, a few comments from other audience members. I want to give an opportunity for other people to have a comment or question. Jane, you have to unmute yourself.
Hi. I'm as Jessica said, a volunteer at the Children's Center, and actually was working there part-time because of the fact that we didn't have enough teachers due to a various number of reasons. We've two very good teachers we had now work in the Sturgeon-based schools, which I'm so happy for them because they are earning more money, they have benefits, so that's good for them. But having that staff availability is a huge, huge problem. I noticed last year when I looked at the graduating classes, high school classes in the county, the number of people that said they were going to be elementary or early childhood education majors. And I thought, oh, that's interesting. How do we get them back? So I think there is a movement. It's not fast enough, but we have to do more to encourage that kind of career path, perhaps, but we're going to have to pay for it. We need to pay better salaries to all these teachers. But the thing I really wanted to say at the end here is, I'm 72 years old. My children are now 41, 43, something like that. And we had very, very similar experiences to Anne's and Jessica's and Lauren's and Myles when our children were little. I expected to be able to stay home. I wasn't able to. So we went through that whole, different home care. The first home care we had, the husband decided he didn't want his wife working anymore. And then he was with somebody else temporarily and somebody else. And it is extremely stressful. And my heart goes out to all of you. It really does. But I have to say, the kids are okay. Your kids will be okay. You are good parents. It'll be all right. And I just, I wish I could help all of you, but thanks for working hard.
Anyone else have anything to say, either from the panel or the other people who are on tonight?
I just wanted to say, I want to just reiterate what Jane said, as someone who is 66 and has a 33-year-old and a 30-year-old. And I've never lived in a rural area in my life. So we just moved up here last June, so a year ago, June. So I'm just agog at what the things I'm hearing. And I also just, when you say, Christina, infrastructure, this is an infrastructure issue, and if this state, this country, you say, like to bring them to Europe and see how it works. I mean, if we can't start understanding that this is infrastructure country, we will just continue to an infrastructure issue. It's not going to get any better. So, but I do want to reiterate, Jane, you amaze me what all of you are doing. So I can't imagine how exhausted you must be, and just the stress alone that you're talking about. I'm exhausted. So,
There's that layer of guilt as a parent too, that, if you can't be there, or it's that tough decision of, well, do I not work so that I can be there? And then that puts you in a housing, situation. I mean, it's just, it's it's a catch 22. And this has been an educational process for me since we had our daughter. I'm a city girl from the Fox Cities area, and when I was younger, I was in home, and then with in-home childcare, and then went off to school. We didn't have like daycare that I went to, so to speak. They existed, but I didn't think this was going to be an issue.
right.
And then on, the back end, ending up, I don't have a degree in early childhood education. I didn't know anything about it. And, stepping into that building and working there and being educated on what they do, how they do it, why they do what they do, it was eye-opening to me, be hands-on and understand from that perspective. And I feel so blessed that my daughter had the benefit of being there, from 9 months up to 4K, and even now the summers, because I can't imagine just randomly taking her and dropping her off at a stranger's house, or not knowing. And we have a grandparent juggle and friends and stuff like that. But I have friends that are single moms here. I worked in restaurants when I moved here and had no idea I was going to end up living here this long. And friends that juggle those schedules, and trying to be, even as a couple, juggling that, restaurant or retail work and the weekend hours and everything. I know DCEDC, I was really surprised to see some numbers that apparently 30%, it's only 30%. We're like number 5 or 6 for restaurants, for like employers in the entire county, which was surprising to me, because the amount of tourism and the amount of restaurants and bars we have up here is a plenty, and retail. But all of those people do need options, and we don't have a good answer to it. There isn't anywhere that's we can barely staff Monday through Friday. How are we going to staff night hours and weekends? So I feel like this grassroots campaign of hitting the streets and educating people in the county, this is a problem. It's a year ago, I was talking to town board saying there is a broadband problem in the county. We do not have sufficient broadband. And I was laughed at. And it's the same thing, like, it all goes hand in hand, the housing, the broadband, and the childcare for infrastructure, which until I heard Steve Jenkins put it together, I was like, oh, yes. It is. It's all the same issue. And, there are plenty of stories of families moving here that, okay, they bought a house, but then they can't find childcare, and they're having a tough time, juggling their jobs with it, or wanting to open a business in the area and can't juggle it all, and then just turn around and sell their house and leave. And that's not a good answer. So, trying to
That's sad.
educate people in the area that this is a problem, because I think unless you're in it, you don't really know it's a problem, unless you have a child or know someone that has a child and you hear them talking. There's
Like I said, it got real for me once we were pregnant.
Yeah.
Well, and that's also why we appreciate all of you sharing your stories tonight.
Yes.
Even though we don't have a huge number of audience members, we're recording this, and
Right.
we can send people these town hall meetings. This great information is shared, and it's all there on YouTube, so that when people come around, we don't have to reconvene again and try and recreate. They can come and hear from the people who are living this. And we are really trying to capture all the different perspectives. So for example, our next meeting on December 8th, what we've got are representatives from HR departments of several employers in the
Great.
county who
Wonderful.
we're going to have this conversation
Great.
about, is it an issue or isn't it an issue? If it isn't, if you don't perceive it as an issue now, do you have plans for the future? All of these questions that people
Wow.
are asking. So if you're interested in that, come back on the 8th
Mhm.
or spread the word to somebody else who you think would be a good person to join that night. And I want to thank you all again so much for carving out an hour at the end of the day. And I know all of you have young children and you got up
I know.
early and also have
Yes.
to take care of them now. So thank you.
We
much.
thank you. Yeah.
Christina, could I just make one small comment?
Absolutely.
It's just that I think there's like kind of a unique Door County economic framework that can put the childcare question into perspective and the housing question and all these things. And that is like I'm the fifth of six, which means I was just raised by my older sisters. And my parents moved up here in the early 1970s in part of that last window where you could still move to Door County broke. Like you could move up here with nothing and live in a shack and raise a family and somehow piece it together. But that's why we had all the artists who moved here in the 70s, because you could be
Right.
a broke artist and start a business. That option is largely gone, at least in the northern half and even increasingly so in the city areas. And back then you could, like if you look at America's household incomes, that was more at a time when you could sustain a family on one income or maybe one income and a part-time income. And those days are largely gone unless you happen to have someone in the family who is making a really substantial sum. So back then, like when some people might say like, well, we did it, or I raised my kids at home, or we figured it out. You need the two incomes now more than ever. And especially in Door County where the housing prices are going higher and higher. And you talk to friend after friend, you cannot find anything under $300,000, $350,000 in most of the county anymore. And the ones that pop up on the market are bought by vacation rental speculators. That's increased a lot in the last couple of years. So those, whatever was affordable, that might allow people to have a little more flexibility in what they could pay for childcare and maybe staying home more often to cover a few of those days, is gone. And America's household incomes have been largely flat for 40 years. So as all those expenses has gone up, the household income stays the same. So that means everyone's got to work two jobs and piece it together, and healthcare costs and all those things skyrocket. So and when I say household income, I mean adjusted for inflation. But it's not just a matter of, I'd hate to see this framed by some people as, well, this is not people in this forum here, but I mean, you hear this, like this generation just doesn't understand what it is to work hard and raise a family. Everyone has to do that. Like there is a framework that just isn't the same for a lot of people.
Right. I just, to that point, whenever someone says, because I graduated from college, University of Illinois, 1976, and I worked my way through. So whenever somebody brings up, what costs or kids or money, and I'm like, I worked my way through too, but it cost $8,000 for 4 years, and I went to Denmark for a semester. So yeah, I hear exactly what you're saying. People need to be reminded.
Yeah, and I think that's part of it, Myles. I think what I'm saying, and I don't always say really well, is that there's been these shifts, but people aren't always mindful of the shifts. They've lived it,
Right.
but it's slowly, and we have this same model that we're applying to how we deal with this aspect, and we've got to come up with a new model to meet, to align with the new economic realities of not only the United States, but particularly Door County with all its specialties and quirks and things that we all love about it.
Right.
And I think there's something to be said too, that maybe, yes, they did that, and there's a bit of a like, pull yourself up by your bootstraps kind of mentality with that. But in our age group, I'll say, Myles, you and I have a little bit of a gap there, but I think for us, the importance of the quality of that childcare and, early childhood education wasn't something that was prevalent or existed when I was growing up. And, growing up, I was one of 3 kids, but my mom was one of 15 and our family was huge. And, we just got passed around to family, and it wasn't a big deal, but it was kids watching kids a lot of the time. And, I think, being an older parent myself, I wanted to make sure that, the quality and the access and the people that were going to be with my child, that I felt comfortable with them and knew that she was in a safe place. And maybe not, under a mountain of larger kids, just, just having who knows what going on. So there's, a lot of that is the educational piece that has come to the forefront now, and the quality that we would prefer to see. And, everything in Door County is a high quality. We want our food to be high quality. We want our retail to be high quality. We want our resorts and their vacation experience to be a high quality, and the impact when they're here for tourism, so that we can stay living here and sustain ourselves here. We want that same quality for our children in our community, whether it's my children or my friends' children.
Well, I know we are almost quarter past the hour. So I want to thank you all. I'm happy to stay on, but I want to give people an opportunity to sign off if they have to, because I completely understand that. And I'm so appreciative of the time that you've spent. Have a great Thanksgiving, but if there are people who want to chat more, I will stay on the line for a few more minutes yet. But otherwise, thank you all very much.
Thank you, everyone, for your time. Thank you.
Thank you.
Thank you, everybody.